Okay, today I'm going to do a video for you to perform a neurovascular, musculoskeletal, and cranial nerve assessment, and then our cranial nerves 1 through 12. So first I'll ask the patient their name and date of birth and make sure they're oriented to person, place, and time. So I'll ask them if they know where they are, what year it is, and to make sure I ID them ×2. And then for the neurovascular, I'm going to inspect first, look at their extremities, make sure their color, temp, cap refills, make sure there's no edema. And then I will ask, and then I'll do the pulses as well. And then I will ask the patient to move their head up and down, chin to chest, see if they can move their head side to side. And then I'll do range of motion for the upper and lower. So I'll ask them to lift their arm all the way up, all the way down, and then side to side. And then the same thing with the arms and the wrists. Make sure they can move both sides and that they have full range of motion in all their extremities. And then I'll have them lay down and do the same thing with the legs. Have them move the leg up and down, and then bend at the knee, and then do the ankle. And then I'll have them squeeze my fingers for a strength test to pull and push with their arms, and then also the same thing with their knees. I'll grab their ankles and they'll pull against me, and then I'll have them push their feet out. I'll make sure there's no pain, make sure there's full sensation and motor function. And then I will do the cranial nerves 1 through 12. First I'll start with number 1, which is the olfactory, and I will have them smell something in the room. Usually it's an alcohol swab. Have them close their eyes and make sure they can identify the smell. And then number 2 is the optic nerve, and I will have them do the Snellen chart, make sure they can read like line 2 or 3. And then I will have them do the 3, 4, and 6. 3 is oculomotor, 4 is trochlear, and 6 is abducens. And I will dim the lights and assess perla, make sure their pupils dilate when I shine the light in their eyes, and then I'll turn the light back on, and I'll make sure they can follow the pen light with their eyes only, and not move their head. And then 5 and 7, 5 is trigeminal, 7 is facial, and I'll have them clench their jaw, raise their eyebrows, smile, puff the cheeks, and then I'll do a soft and sharp test, maybe with a Q-tip or something, and ask them, close their eyes and ask them if it's sharp or soft that I'm rubbing against their face. And then 8 is acoustic, auditory, and we do the whisper test. So I'll have them cover one ear, go to this side, and whisper 3 words and see if they can repeat it back, and do the same with the other side. And then I'll do 9 glossopharyngeal, 10 vagus, and 12 hypoglossal together. I'll have them stick out their tongue. I'll inspect their mouth, make sure everything is pink and moist and it looks good. Make sure their throat isn't swollen or red. And then I'll do the gag test, have them say ah. I'll have them move their tongue side to side and up and down. And then 11 is the accessory, and I will have them shrug their shoulders and then put my hand against their head and have them push their head against my hands. And then I will do the deep tendon reflexes. There's 3 in the upper and 3 on the lower. The deep tendon reflexes are the bicep right here, the tricep, and then the brachial radialis. And then on the knee, that's the plantar. I'm sorry, that's the patellar. And then the Achilles is in the back of the ankle, and then the plantar or the Babinski on the foot, and then I'll have the patient stand and walk heel to toe, and then I'll have them do the balance test. I'll have them close their eyes, stand still, and I'll stand close to them and make sure they don't fall, and I'll be there if they do. And then we'll do the, we'll finish it off with the Glasgow coma scale, and that's it. Make sure they're not in any pain during any of the assessment. Make sure they understand, and if they have any questions, go ahead and answer those for the patient.